Hi, this is Sharon Coronado, and this is my patient Dan. And today we're going to do an exam on the gastrointestinal system and the kidneys, and also I'm going to explain how you would do a self-breast and self-testicular exam. I'm going to start quick by taking a general look at Dan. He emptied his bladder. He's sitting with his knees up and his arms by his side. And when I look at his abdomen, I see no pulsations, no peristalsis. I see no lesions, good skin coloring, and nice and warm and dry. And the next thing I'm going to do, I'm going to listen to his bowel sounds with my stethoscope. My stethoscope has a combined function, so when I use the diaphragm, I press firmly, and when I use my bell, it's light pressure. So first I'll start listening to the 4 quadrants with my stethoscope, see if I hear bowel sounds. I hear good bowel sounds readily in the upper quadrants. And then I'm going to go to the lower quadrants. And I listen and I hear good bowel sounds in all those areas. So you're positive for all 4 bowel sounds. Next I'm going to check with the bell of my stethoscope, and I'm going to listen over his aortic area, his renal artery, and I'm going to find his iliac crest and listen for bruits in the iliac area and the femoral area. Okay, so I'm just listening. Okay, I don't hear any bruits there. The renal artery is probably about here. Okay, I hear no bruits there. Iliac crest. Let's come over and listen there. And then I would also feel for his femoral artery in his groin area and listen for bruits there. And I would also do the same on the other side. Okay, I'm going to start by doing some general inspection with, I'm going to do a little light pressure and checking around to see if you have any discomfort when I lightly palpate. Is there any discomfort when I feel around?
No. No.
Okay. I don't feel any masses or anything. I'm going to now press a little bit deeper in, and I'm going to feel for if I feel anything. With my hands, any of that feels uncomfortable?
No.
Okay, I'm going to press in, and if I let go, do you have any pain with rebound?
No.
Okay, good. So I would just feel around his whole abdomen. Next, I'm going to try to feel to see if I can feel his his liver on the left upper side into his rib cage. I'm going to try to hook my hand around here, and I'm going to just have you take a deep breath in and let go. I'm going to just try to see if I can feel, and I also can see if I can feel right under in the mid-sternal area too as well. And the other thing I'm going to try to palpate is his spleen on the left side, and that would be kind of anterior axillary line, and it's usually around like the 6th, the 7th intercostal area, and I don't feel his spleen when I palpate. And I also can try to see if I can palpate his kidney by kind of putting my hand underneath and feeling around on the side, and I can also check to see on the opposite side if I feel anything, which I don't. So the next thing I'm going to do is some general percussion, and I'm going to start just by percussing your abdomen. And when I percuss your abdomen, I hear some like tympanic sounds. And the next thing I'm going to do is going to see if I can palpate or percuss Dan's liver. So I'm going to start in the mid-axillary line and right underneath the nipple. I'm going to just start there, and I'm also going to kind of come up and percuss from like the umbilical mid-clavicular line up. And I'm going to start to see where I feel resonance to dullness. Okay. Okay, so I feel a little dullness here, so I'm going to just put a piece of tape here. And I'm going to start here right around your umbilical area and kind of percuss up in the mid-clavicular line. Okay, I feel some dullness right about there. And this just measures your liver, size-wise. And it's right about 8 centimeters, which is normal. Okay, and I'm going to also see if I can percuss and see if I can hear Dan's spleen. So mid, or I should say anterior axillary, I'm going to find at the bottom of his ribs. See if I hear any dullness. Okay, I don't hear any dullness. Okay. So the next thing I'm going to do is have you just sit up with your legs over the side. And I'm going to just see if I can identify Dan's CV angle, which is the contra-vertebral angle. So this would be like the bottom of his rib cage and his spine. And this little angle here is right where he might feel some kidney pain if he had any discomfort. Does that hurt when I do that at all?
No. No.
And when I press, any discomfort?
No.
Okay, and I would do the same on the other side as well. I don't feel any lesions or any discomfort is noted. Alright, so now I'm going to just explain to you how you would perform a monthly self-breast and testicular exam. Whether you're a man or a woman, it's always important to do a breast exam, and monthly, usually it's good to do that by first standing in front of a mirror for both exams, for testicular and breast. And you want to see if you notice any dimpling with your breasts, any masses, any lesions, anything unusual. You would want to report that to the doctor, and with your testicles as well. Taking a shower sometimes is a good thing right before you do a testicular exam. It helps the scrotum to relax. And when you first start doing the breast exam, usually it's good to have either lying down with your arm over your head or in your hand on your forehead, so it kind of spreads out things. And you want to start first using the 3 opposite pads of your fingers, and you're going to start underneath your axilla, and you're going to palpate down in a vertical way up and down to see if you feel any masses, any tenderness, any lumps, any discomfort. You would want to report that to your doctor. And then once you move closer to your nipple, that's the mid-axilla, the mid-line, you want to stretch your arm out more like this, and then you want to continue on, because that helps to stretch things out so you can feel any masses or any tender lumps, anything. And then with your testicles, after the shower, you take that. It helps relax things. You want to cup your testicles with both of your hands, with your thumbs kind of on top, and you want to gently roll your thumb over, the right and the left testicle, and see if you feel any lumps or any, pain. You can feel lumps and have them be non-painful, or anyway, you would want to report anything you feel like a lump to the doctor right away. And in the back of each testy is the epididymis. It's like a cord-like structure, and you also want to palpate that for any lumps. And as I said, do that on a monthly basis, and that's good, just to keep an eye on everything. All right, and report any changes to your doctor. And that's it for our exam today. Thank you.